And we're going to dive into a big topic that is happening in the courts right now. Toronto's chief public health official has won the right to intervene in a court case where a father is fighting to have his daughters vaccinated. His former wife, that he's now divorced from, her lawyers argue, and is posted in an article in the National Post. Mom says that having your children vaccinated is a personal choice. The reason why public health is now getting involved is they say this misinformation that surrounds vaccinations is posing enough of a concern that it justifies public health getting involved in a family court case. So she's won the right to get involved. Dr. Eileen de Villa, was that the right call?
This is, it kind of breaks my heart, to be honest, because we know that there are certain diseases that have pretty much all been eradicated due to vaccines. And slowly they're starting to reemerge in certain communities as a result of people choosing more and more not to vaccinate their children. And I personally just feel like it's an incredibly misguided and selfish decision because you're thinking of your child. And I believe that parents have the best of intentions, but based in misinformation and paranoia and, internet, like rabbit holes, you've made this decision in order to protect your child, but you're putting other people, other vulnerable people at risk. And I just think that is so misguided. And I'm not going to get into the statistics around how problematic this could be. What I will say, though, is this does present an interesting dilemma in terms of going forward. Like how do we then look to guidance from, let's say, public health about what we can and cannot do with our children? And I just think about, for example, when a COVID vaccine comes about, if the government decided to step in and say this was mandatory, I mean, it's so new and it feels like the disease, there's still so much misinformation around it and it is ever evolving. And the vaccine will have come at an unprecedented pace. So I wonder if this situation could set a precedent going forward and if that might not have implications that we haven't yet thought about.
Yeah, Cynthia, you talked about information and misinformation and people who are misguided. And I think we're living in a time where, for some reason, there are so many people out there who are not trusting and even trying to undermine experts. And they're experts for a reason. And I don't get it. I don't understand when we came to this world, this existence where we look to people who have spent so much of their lives doing things to make them an expert in certain areas. And to be able to be an expert, especially in science, you are peer reviewed, right? So there are other experts who are supporting your work. And there are so many people denying a broad scale of actual science and research, and it has led to situations just like this. I think it's very scary.
Mm-hmm. You know what? I feel like this is a really interesting case to follow because, like you said, Cynthia, we have hopefully a vaccine around the corner for this disaster. I mean, listen, we know what life is like without a vaccine. We're living it right now. So for a lot of people who are doubting it, I think that there has been so much science and expertise put behind this. I'm not as concerned about the speed with which we're trying to find vaccines. But going back to this court case, there is a reason why there are things like laws that protect the most vulnerable in our society, like the sick, like the elderly, and like children, because we have beliefs and a value system that run our society and are upheld by laws in our court. And one of those things is how we treat our children. And I do believe that the vast majority of parents, we all have the best intentions for our children. But sometimes, as a judge said in Alberta in 2016, love is not enough. I'm talking about a case where there were parents who clearly loved their toddler son. He came down sick. They thought he had croup or the flu. Turns out they were treating him with natural remedies from their doctor, naturopathic doctor. And sadly, their son died in the end of meningitis. The court in that case said the parents failed to provide the necessaries of life. We believe in our society that child abuse is wrong that child neglect is wrong. And I don't know one parent out there who's going to say that it's right. The courts have to step in when sometimes parents are not clear about the difference, or they believe they're doing the right thing, but sadly, science, medicine, public health says otherwise. So I really hope that the outcome of this case is a positive one. I say that clearly through my belief system, because there are big implications down the road.
Yeah, it's interesting, Mel, that you mentioned a couple of words in there: belief, as well as naturopathic approach. I think it's safe to say when we look at some of these groups that are anti-vaccinators, they are, well, from my own experience, from my own knowledge, some of them here in Vancouver, where we've had a measles, like this is a modern age, we're talking about 2020, we've had a measles outbreak in Vancouver in 2014. Dozens of kids were infected with measles, and we just had one in 2019. There's a vaccine for measles. The fact that we're still seeing an outbreak of that, but where it actually happened is interesting because it happened at a religious school. Now, by no means am I attacking the religious group or the naturopathic community. But listen, I'm a person of faith myself, and I can tell you, I've read the Bible many times, and nowhere in the Bible does it say, thou shalt not vaccinate, thou shalt deny science. When it comes to the safety of our children, and I think this is the message that we're all sending right now, is that has to be in the forefront, the safety of our kids. Knowledge is power. I think the misinformation that has been out there, and it is misinformation because people have not done their due diligence in going out of their way and doing their own research. And instead of misinformation, there's lack of knowledge. And I think people need to revisit their belief system and their own convictions, because we're talking about these little people who are relying on us to keep them safe. And that's really how I feel about it. It's just misguiding information, and people need to really, really revisit those belief systems, because I don't even think those are actually embedded in those belief systems.